We have a special guest joining us this afternoon for our OASIS training. So we have Dr. Patricia Kallenbach from Florida, and I'm going to officially welcome you and thank you again, Dr. Trish, for joining us and sharing your wealth of knowledge with the group today.
Happy to.
And we're going to have some images so everybody can see Dr. Trish in action with some of the things that she's doing. But before I get into my line of questioning, I'm going to give you a brief introduction. And normally what we do in our training sessions is people will ask questions as we go along. But what we're going to do today is we're going to save the questions till the end, and you can write them out or you'll be able to chat. We can unmute your line to ask any specific questions to Dr. Trish. Everyone will have an opportunity, so don't be shy. Lots of interaction is good because it will help us all learn. So on that note, giving you a brief background on some of the many things that Dr. Kallenbach does, I'm going to refer to her as Dr. Trish, only because we've been doing this, I think, for like 6 or 7 years now. I think it's been a long time. Yeah. It's all good, as they say. So Dr. Patricia Kallenbach earned her bachelor's and master's degrees and a doctorate of veterinary medicine from the University of Florida. After graduating from the University of Florida in 1993, she worked for several years in a conventional veterinary practice before opening her own holistic veterinary practice in 2002. This new type of veterinary clinic offered integrative veterinary care and many alternative therapies such as veterinary orthopedic manipulation, myofascial release, homotoxicology, acupuncture, therapeutic nutrition, and frequency specific low-level laser. And she will be talking a little bit about some of these too. That's one of the questions I have for her. These had previously not been available to pet owners living in the Natural Coast area of Florida. Back in 2011, she relocated her practice, The Healing Place, very appropriately named, as I always say, to a larger facility in Crystal River, Florida. Dr. Kallenbach shares her knowledge and expertise not only with us folks at Omega Alpha, she also has published a number of articles and videos which will be available on the website, which I will give everybody the information for. She does teaching seminars for other veterinary professionals, and she also, which I love this, she gives free lectures for local clients, clubs, and rescue organizations. So you always have love to give back to the community. I think that's wonderful. Thank you. It's always a good thing. And speaking of good things, we're going to go back to when Dr. Trish decided to become a veterinarian, and then how she basically launched or transitioned, or actually she does a little bit of everything here, and she is going to explain how she got so heavily involved in holistic pet care, if you wouldn't mind.
Right. And again, the nutrition part of it just came along from growing up. We lived in a small town. We had a large farm. We didn't have veterinarians near. So we already I just grew up on a farm environment, really concentrating on nutrition to optimize the pet's health so that we did not have to rely on veterinary medicine in most circumstances. When I got to college, I followed through with that, and I got my bachelor's and master's in animal nutrition to really seal up that initial set of knowledge, and then carried that into the veterinary world. I had been out practicing about 6 years, got a flyer in the mail that said, "I can fix things you can't." And that piqued my interest. I called and spoke with the veterinarian about, what it was he was doing. And that was the VOM, the veterinary orthopedic manipulation. Got trained in that, and just kept adding more things as I got comfortable with each thing. Ran out of veterinary courses, started taking human courses to just understand the knowledge of how it worked with the body. Didn't really care whether it was on human or animal, and just kind of added more tools to my tool belt. And as you said, I practice integrative medicine. I'm not opposed to us using a medication or using in our conventional things. I just like to rely on those last, or in the emergency situation, and then use some of the more natural things to get things back into balance and just have less side effects and longer quality of life with nature.
And I think, and everyone will find this out about you very quickly, is that you're very passionate about what you do, and you would never back down from a challenge, which I've seen. And just from you speaking about things, anything that's challenging, you'll go right at it head on, really, with regards to improving animal health care ultimately.
Yeah, and with the VOM instructor, when he would instruct other people, I mean, back in the late 90s, it was a fairly hostile circumstance. It's a little better now, but not much. And he would tell people when he was training, he was saying, if you go home and you're getting backlash and you're getting negative from surrounding vets or the vets you work with, call Dr. Trish. She's not going to make it better. She's going to tell you how her day is, because it's much worse and much more aggressively negative, the environment she lives in. So you'll feel so much better about your day. And I was like, yeah, that's what it is. And but the one thing he stressed is, don't try to convince the naysayer or the non-believer. Put your head down, do a good job, do the best job you can. Your success will lead you to where you need to be.
Absolutely. And it's true. And back then it was the road less traveled, because that was many years ago. Definitely. Thank you. In addition to your formal veterinary training, you mentioned I mentioned some modalities in the brief introduction I made for you there. Which modalities are you certified in? If you could let us all know.
Yeah, so I'm certified in veterinary acupuncture, which I actually use very little, but the knowledge was what I learned it for. I'm certified in the VOM, the non-manual instrument-based adjusting, and the myofascial release and somatovisceral therapies that go with that. I'm certified in homotoxicology, which is actually an expansion on classical homeopathy, where you use lesser dilutions but more remedies all at the same time to kind of affect all the toxic effects happening to the body at the same time. I got that certification in a human practice management over in Germany. And then I'm also certified in ozone therapy in the veterinary field. And the laser therapy, the low-level laser therapy, while it's more commonly used in the human field, they do train us in the veterinary field for this particular type of laser therapy. And then, of course, my bachelor's and master's in nutrition, and I've taken quite a few other nutritional courses, even though they don't technically give you certifications.
Now, this is interesting. When you have a cat or a dog in front of you and you're trying to figure out which of these modalities to use, how would you go about, because there are so many to offer, which I think is wonderful, how would you go about choosing the appropriate one for that particular client?
Each modality has its own strength, and some will just work better for a certain circumstance than another. So you kind of till through that. You do as good of an evaluation, blood work, whatever you have at your disposal, and then you really start going through what modalities work best in those circumstances. What modalities will the pet tolerate? Because there are certain things that the pet's too painful or too fearful or whatever, when we have to choose different ways about it. We also have to look at how close the client is and how frequent we have to do the treatments. Because if you're needing to come in every day and do something, I have clients that come from 2 and 3 hours away. That would not work. So sometimes we have to choose accordingly with that. I have some dogs that are so big and so injured they can't transport them to the clinic, so I need things they can do at home. And so we factor all of that in. And then, of course, we have to factor economics in it. We all love our pets, but we all have to keep that. I've got to pay the bills and put food on the table, and then take care of my pet with the discretionary spending. And we need to always present that in a very respectful way to the clients.
Absolutely. And there's a top-notch professionalism, I know, that goes on, not just with yourself, but also with the colleagues and everyone you have working there. And this is another thing that I love about your clinic too, that you bring in, and we're going to be really focusing on the pet supplements today, but you also have some of the human line and some of the equine line as well, if I'm not mistaken.
Yeah, I eventually got certified and licensed as a massage therapist, a certified personal trainer, functional stability. And so we do carry the human lines, and I actually have half of my clinic. It's 2 side-by-side clinics. Half of it is my human massage and wellness clinic, and half of it is my veterinary clinic. And then about 45 minutes south of me, my family has a training facility, and my sister is trained in the adjusting and the various things. And we've got the laser and TheraPlate and everything, and we incorporate the nutritional supplements into the equine world there as well.
Excellent. Might as well help out the whole entire family. Why not?
Exactly.
All right. Starting on the right foot. And we all want to do what's best by our pets, of course. Oh, and we're seeing this becoming more and more prevalent. A lot of pet owners are really reaching out and considering other modalities and looking at holistic approaches. What would you consider to be the 3 top things that really need to get someone started in the right way?
we have to start off with nutrition and gut health. If we're eating a crappy diet, we're going to be creating part of the problems we're trying to fix. So we've got to get with a good food. My general rule of thumb for food is that when you look at the ingredients list, I want the first two words to have had a heartbeat. I don't really care what protein at that point. I just want it to have more meat than anything else. I don't want any wheat, corn, and soy. I don't care about the grain-free component of it. I just don't want the wheat, corn, and soy. They're poorly digested. They're pro-inflammatory. They're poorly utilized. Rice and oatmeal are perfectly fine. Don't care about, excuse me, about those. I don't want it to be the first or second ingredient, but they're a fine carbohydrate. And then thirdly, I don't want byproducts, even if it's the 37th ingredient. If anything on there is below human consumption, it at least draws into question everything else on that list. And so we make sure they're on a reasonable food. There are reasons to narrow the description of the food or the choices for medical reasons, but it's just for the general starting point. That's a good starting point, those three rules. And then we want to support the gut health in other ways. We want to get them on a probiotic. We want to add digestive enzymes if we need to. Things of that nature help out the liver if we need to, but we have to start with that. Secondarily, we want to look at what's the rest of their life. Where are their toxins, medications, whatever the circumstances that could be additionally burdening the body that we can potentially change around a little bit or do differently. Even our heartworm and flea medications. Again, I'm not opposed to the heartworm and flea medications. I'm vehemently opposed to Trifexis because it's just a horrible product in my mind. It works. It's just horribly toxic. So I'm not a big fan of that. I get them off of that. I still put them on a Heartworm prevention. There are just, and people ask me which ones I like, and I literally tell people anything else on the planet but that one. It's just that awful. So I'm not brand specific. They all have their weaknesses and strengths. And then we want to look at what's the rest of the quality of life of that pet. Are they in a stressful circumstances? Are they in a smoking environment? Are they in where they're traveling all the time and they're not a good traveler, and that adds stress and metabolic changes? And are they getting the activity they need? Are they in a happy environment, or are they trapped and going stir crazy? So we have to start with those three premises. And sometimes I tell the story. Years ago, I had a little Dachshund treated by a local veterinarian, back problems, screaming pain, everything they could throw at it could not get this dog comfortable. We came in, she got referred up to me. We did adjustments and massage and injection acupuncture and all kinds of things, got it doing very well. It's on a maintenance routine. It comes in right back to the screaming pain. I do all my stuff. It goes home 3 days later, it's right back in. And I said, okay, I need the whole family to come in. And so the whole family comes in with the dog. And I said, what's going on in the household? Because there's something that's stressing this dog out and causing these muscles to go back into spasm. Well, the lady was waiting on a biopsy to determine a pretty important cancer. And so the whole household was stressed about that. And I was like, yes, here's some Valium. Your dog's going to need to de-stress and whatever. We'll deal with it afterwards. But in this circumstance, I'm not going to be able to rehabilitate this because this dog is feeding off your completely understandable stress in the household. And so let's work around this, and we'll get back to that once things settle down. And that's what we did. But sometimes it is these outs. And they were like, how did you know that? And I'm like, because this stuff works. And the fact that 3 days later, your dog was in screaming pain again, you're playing football with them and hunting across the yard, and I know that's not the case, or there is something else out that is causing muscle spasm in this dog, and it had to be stress.
Yes, absolutely. And I always say that animals are very emotional beings and they pick up on what's going on around them. So I'm glad that you really emphasize that when you're talking about health and how that could be negatively impacted, the emotional aspect. Excellent. Thank you. Now, I forgot to mention this morning, I love this image that I grabbed to include in the presentation. And like, who doesn't love puppies? These puppies are adorable, but we just try to choose the appropriate. You get to see, so you do get to enjoy a lot of special time with the animals too. And I can tell that you're an animal lover. Why else would you not be doing what you're doing? So
yeah.
Yes.
We had a tiny little 5-6-week-old puppy in this morning, and like the whole staff had to go eyes and have 3 minutes of a break just to get our puppy fix.
Oh, I know. That's amazing. I'm talking about de-stressing. That's wonderful. Now, for you, what is the single most important message you try to get across to pet owners with relationship to choosing a holistic approach?
It really is a circumstance of taking the time to let us heal the dog, or the cat or the whatever we're treating. We do talk about our conventional practice has put them on the medication for the itch, the infection, the whatever. And then when they take them off, it comes back. And so they've done this rinse and repeat. And while I'm fine with adding those conventional modalities on if we need to for comfort stress, we're digging a little deeper and going, there's something going on with this pet that's allowing this to happen. You know, the dogs with skin infections. All the dogs on the planet have the same bacteria on their skin. Why is this dog sloughing it and making big sores and the other dogs are fine? And so we have to dig a little deeper and look at what can we do to heal that. And in the meantime, they bring us incredibly, sometimes we're the last step. And so we get some really bad cases in. I just had a little Dotson this morning and it's 14 years old, but it's got like 40% of its hair. Everything else is bald and thickened and gray and elephant and secondary yeast all over it. And so, yes. And she said, the only thing that's ever brought this dog some comfort was some Cytopoint and some Apoquel at the same time. And my vet doesn't want to do that. And I said, well, I can understand that. They're both immunosuppressive, but they don't indicate any. They're not contraindicative. They're just not, we just don't like to do both because it's not fixing the problem. But if that's what fixes it, this dog is miserable. Yes, let's put them on that because in 2 weeks, I'll have enough time to fix some of the underlying things to get that pet to a better thing that now we can get them off those meds and get things comforting. So, but it's mainly understanding there's a process that we have to give the body time to heal itself. We're not putting a Band-Aid on it and blocking the symptom. We have to give the body time to heal and to give us time to go through all of those steps, to just patience, because, you know, our conventional practices, here's a pill, it'll be better in 2 days kind of thing. And we're just not having that when we're letting the body heal itself.
And I know you do have very thorough examinations. I know you've mentioned before that for a first time visit to your clinic, it would be what, 45 minutes with questions and explanations, which is something that's foreign to anyone who goes to a conventionally trained vet where they're getting the regular maybe 15 minutes or, you know, very short periods of time.
Right.
Now that too, and being realistic about expectations, I think too, and I know education is huge with you and everyone you work with there. So how do, when people come in and you spend all that time with them, are they just kind of flabbergasted and it's just overwhelming? Or
it can be. I do have to reel myself in all the time because, you know, as I mentioned, I can talk my clients into a coma in a heartbeat. They'll just leave and just overwhelmed. And so I do have to kind of put it as, we're going to do this in 3 stages. We're going to do this. And for the next couple of weeks, we're going to see what that fixes. And based on what it's going to fix, then we're going to build this in. And then we're going to build this in. So when you put it in just a couple things right now, we're going to work on, and in a couple of weeks, we'll add some others if we need to. It does a couple things. If you put them on a whole bunch of stuff at one time and they're better, we don't know which one fixed that pet. And we don't know which supplement or modality fixed which symptom. So they're going to be multitude of things. So we want to take that step-by-step approach. And if we just keep simplifying it down to, it's just these 3 things that we're going to work on today. Typically I do kind of blocks of 3 and I go, and we're going to write it all down and we're going to highlight it and we're going to call you in a few days and go over all of it again, because my staff understand I kind of talked you into a coma and you're going to have a trouble driving home today. And then we call them a week or so later and we go through it again. And we tell them any way they need to communicate with us, text, call, email. If they have questions, the only stupid question is the one that was not asked. Every question has a reason, whether it's just clarifying something in their mind or not. And, you know, it had great impact. A dear friend of mine that I met back when I was in my mixed practice, he just came to me on emergency with a diabetic dog. And I evaluate, it was on emergency, it's the middle of the night, and I explain all this stuff to him. And then I ask him to repeat it back to me, and he couldn't. And so I simplified it and I explained it to him again. And I asked him to repeat it back to me, and he couldn't. So I simplified it again. And it was not the job. My job's not done until they understand what I said. I can use all kinds of big words and all kinds of things that they can be expressed as all get out. But if they don't understand what's going on in the dog, how they're going to do things and why they're doing them, I didn't do my job. I tell people, I'm not fixing your dog. I'm teaching you how to fix your dog or your cat or your whatever. And he, you know, after that visit, we became dear friends for the rest of his life. And he said that was just such a telling thing. He went home and told his wife, we have to go meet this person. We want to be friends with this person. This was just, we just like this person kind of thing. And it just, that's how I had always been. And in that practice, the technicians would tell me, we don't like to work beside you. You're an excellent vet, but you take too long in the exam room with the clients. And we've got too many things to do. So we just don't like being your tech. And I was like, well, that's okay. Go away. I'll call you if I need you. I don't need you anyway. So I'm okay with that kind of thing. And they were like, but when they had problems, they came to me. They didn't come to the senior partners because they wanted that time taken to understand and see what was going on.
And good for you. You're a straight shooter. That's what I like about you as well. You know what? You always know where you stand with Dr. Trish, which is a good thing.
Yeah.
This is good information. I know, I love the fact that you put so much emphasis on education, because we do as well at Omega Alpha. And so this is why it's nice to have you join us, because we're both kind of on the same level that way.
Yeah.
Excellent. It's all good. And I know you're very passionate about what you do. It's very obvious. What do you enjoy the most? And I mean, don't hesitate to just listing one, because I know it's impossible. Yeah. What really kind of gets you going about following a holistic approach?
Our day-to-day life, the things that just really make it happy, is that light bulb over the client. Again, that nearly bald Dotson this morning that spent God only knows how much money on this poor dog in the last year and a half. And I sat and went, here's what I think is the underlying problem. Here's why I think it's progressing to this. And here's where I think we need to go to do this. And the owner, the husband, was just like, that makes so much sense. I'm so much more comfortable with what's going on with my dog and the journey we're about to take. And so that is just every client leaving with that just difference is just a really great scenario on our day-to-day. Yes, the other end of the spectrum is, it's cool as shit to fix things nobody else can. It just is. When we get that, they have tried everything scenario, and they come to us, and we can just get that quality of life, get whatever time that we can, that with good quality and improvements of things that the doctors had said could never happen. Perfect example, I got sent in a 14-year-old Boston Terrier, congestive heart failure, chronic kidney disease, huge tartar. I mean, big green mounds around every tooth. You couldn't even see teeth. They're just these big grain rounded over mounds of tartar. No teeth visible. Their vet has said, I cannot do a dental on this dog. Obviously, congestive heart failure, kidney failure. We can't put it under anesthesia. At some point, the teeth are going to fall out. We don't have anything else to offer you. They come down. I'm like, well, okay, it's 14. We got these diseases. We got to travel slow. Let's just start doing some probiotic. Let's start tweaking some things, and we'll keep an eye on things. And she calls me in like a week and a half and says, Trish, I really appreciate your help, but we don't have to worry about the teeth anymore. And I'm like, well, okay, why? She says, well, because they're all falling out on the carpet. And I'm like, well, no. Not 10 days after I saw your dog are they allowed to fall out on the carpet. Bring your dog back today. Oh, wait, today's a good day to recheck. She brings the dog in. I lift up the cheeks, beautiful white teeth. These big, huge green chunks have been falling off in their entirety. Wow. On her floor. She's finding this big green chunk that used to be in her dog's mouth and is assuming the tooth is in it.
Oh.
She's not looking at it to see that there's no tooth in it. Big green thing was in dog, is now on floor. Oh, that must be the tooth. And I'm like, okay, your dog wins the gold star for the best I've ever seen a probiotic work, because I hadn't done enough things. We were traveling so slowly. I'm like, it had to be that. There was nothing else I had consistently gotten going on this dog other than the probiotic. It was like, okay, your dog wins the gold star. I've never had that since then happen that dramatically, but literally inside of 10 days, these dogs, all these big mounds of tartars just started shelling off.
You know what? That's interesting. I'm glad you shared that with us all, because in all the years I've been at Omega Alpha, we do recommend probiotics quite frequently because they're so important, but I've not heard a story like that before. So that's really important.
The day before cell phones, why would we have not have been able to picture that with a date on it to go, oh, look, here's a before and after.
Absolutely. Oh, no, that's very good. Now, with you doing the holistic approach in your area, do you get a lot of naysayers? And I mean, back in the day, I mean, you've come a long way, many years have gone by, but to this day, are you finding more and more people are a little bit more understanding? Or are you still seen as a quote unquote witch doctor kind of thing?
I am to some degree still the witch doctor, but there are more and more people who do refer things in. They simply tell their clients, I've gone as far as I can with conventional medicine. If you're interested in some of these alternative approaches, we do have a doc here locally that can let you know if there are other modalities that might be able to help your dog. And, and it goes everything from the one vet forever that would literally tell his clients, I have no idea what she does and I have no idea how it works. It just does. If you're open to those modalities, go see Trish. And I was having some kind of event, and I'd gotten this old dog that literally, big hunting dog, so painful, had stopped eating, had stopped everything, all the pain meds, just really bad, couldn't walk, couldn't stand. And they heard about me. He didn't refer it in. He sent it home to say, have a few days and call me to euthanize the dog. It's just that bad. You need to do this. They come to me. I get it literally up and standing that day. It's a couple weeks in and we're doing it, and they happen to mention, hey, we're going back to Dr. So-and-so for my vaccines. And I went, okay. And so I call up the doc and I went, by the way, I hadn't communicated with you. So-and-so's coming back for his vaccines. He's not perfect, but he's doing a heck of a lot better. And he literally said, I have got to come over there and figure out what the heck you do, because I literally sent this dog home to die and to be euthanized once they had some quality time. He was like, I have just got to come over there and figure out what the heck you do. And so we get those. I still have the ones that hate me, that they just do. And I just go, okay, it's what it is. I can't get records from them. I know people who work there, and they will intentionally come by and bury the records so that they never get to the top of the stack to send me the records that they legally have to, and I go, it's okay. Yeah. Again, if I get a client that says, why didn't my doctor who knows you refer it in? I always go back to, if they don't understand, if they're not knowledgeable about that modality, if they don't realize it can help, aren't they breaking your trust to try to recommend something that they have no ability to know if it would help you or not? I mean, there is that professional, and so I don't cut them any slack. Well, I don't cut them any grief on that. If they don't understand it, they're not going to recommend it.
Absolutely. And I know there's a lot of integrity there at your clinic, and you always treat everybody professionally. So, I mean, it really is. And I know we're going to talk about this a little bit later on too, when we get to the diet and the nutrition and everything. And we're going to get a great dose of information from a nutrition perspective too, from Dr. Trish. So I know with the good, which is always wonderful, everybody loves their job when good things are happening. But what is the most difficult thing you encounter when using holistic methods?
Kind of retraining the owner. Again, back to giving us time to get the job done. We're not going to fix it in a day. Sometimes having to re-educate them on what some of the modalities are. Some of this stuff is kind of, out in the air, voodoo stuff. And so, it is here's down to the science. Even homeopathy. I explain to people, homeopathy is a wavelength. That's all it is. Whatever is going wrong with you has a certain vibrational frequency, and the homeopathic that will bring that back into balance, that will neutralize that, is the modality, is the homeopathic that has the exact sine to cosine opposite wavelength. I mean, in the simplest form, that's all it is. The sine and the cosine wave negate each other, and you get a flat line if you add them together, and that's homeostasis. So when I can explain it down to some type of that makes sense logic, I can get them past some of the potential preconceived ideas they have about some of this stuff.
Now, I'm going to ask you something that I know a lot of science-minded individuals, they think, well, this is all hocus. It's hooey basically, and there's no real science to back up, because I know it's all about it with veterinarians. All veterinarians love to see the science, and that's normal. That's normal to hear. But with regards to homeopathy and things like that, what do you say to the individual who questions that and says something?
So most of the studies that are done on homeopathy are from Europe. We don't have any that I know of from the States. And yes, they were probably originally done back in the 1600s, because it's based on a strong stimulus causes one thing in the body, and the diluted of that same stimulus causes the opposite. It actually fixes that. So if you take Ipecac, which makes you throw up. Those of us of our generation, their parents always had it. You ate something stupid, they gave you a spoon of Ipecac, and you pretty much gifted everything in your stomach for the last 3 days back out. If you take Ipecac and you do a 1 to 10 dilution and succussate, and you do that about 100 times, the remedy that you're left with will balance out that nausea. So it's about the strong versus the weak stimulus that gets you those two opposite wavelengths to balance that out. So yes, the studies were done in Europe. Yes, they were probably here, chew on this. Oh, bleeding profusely. Okay, great. The remedy will resolve that. So it probably wasn't the best initial stuff back in the, 14, 15, 1600s. But there are some relatively good ones. The secondary part of it is, if you give a homeopathic to a pet, I could probably talk a human into going, here, this is going to fix you. And mind over matter, maybe it could, even though it was straight water. You can't trick a dog. You can't trick a child. You can't psychologically talk them into mind over matter. And so if you use a remedy and it works, what more proof do you need? Because I couldn't talk that dog into, hey, this dilution of something that's really only vibration of electrons around a water molecule is going to make your nerves feel better and you're going to be able to walk. I can't talk him into that. I'm not that good. So if it works, there in my mind, it'll, how can you dispute that scenario?
Yes, that's a good point. And also going through, keeping your nose to the grindstone, as you mentioned before, and just keeping on your path. It's you really have to develop a thick skin, I would think, to a certain degree.
It's not really a thick skin. It's recognition of lack of knowledge. Am I going to be upset about somebody who has a preconceived idea about something that they have no educational information on? And am I going to get angry about that if they express that opinion? No, I'm just going to look at it and go, that person doesn't have the knowledge to make that. It's a preconceived idea. And maybe it is a thick skin, or maybe it is, I just don't care. Consider the source and take it from there. If you're a moron, you're a moron. I don't care. And I mean, I tell people years ago, my sister we all have liver problems. We're American Indians, so we don't have the strongest liver. She would go to the hospital in crazy pain. They would keep her there for 3 to 5 days. They would run every test on the planet. They could not find out what was wrong with her. Her insurance would run out and they would send her home, never having given her anything for pain because they didn't know what was wrong. Finally, my parents call and they're like, she's at her house. She is writhing in pain and she will not let us take her to the hospital. So I grabbed up all my homeopathics. I drove down there, middle of the night. I'm concocting all these things and asking her questions and dosing her up. It took about an hour and I got her out of pain and asleep. And I told my parents, every time she wakes up, give her a squirt of this combination product that I've got. And yeah, she's going to feel like she got kicked in the stomach tomorrow by a horse because she's been cramping for hours on end. She's going to be sore, but it'll be fine. And she keeps that homeopathic around and takes it as needed. And it was funny because my dad's not really a medicine kind of person. And I'm making all this stuff together. And he was like, well, I don't know that I'd take all that stuff if I was that sick. And by this time, it's like 2 o'clock in the morning and I'd kind of driven through a minor hurricane to get there. And I said, Dad, you're right. Some people are just stupid enough that I have to let them die. And he went, oh, it's time for you to go home. You're testing. You've got to go. I was like, okay, Dad, whatever.
Always giving it your best. And you know what, that's the thing, right? And that's continued on now. And that's the reason why people keep coming back, because they know you're going to try everything you can. So that's always
realistic.
Yes, of course. Now, this is the part where, I love everything. And that was a new story, by the way. In 6 years, I hadn't heard that story. So there's always something new that I get from these interviews. We're going to talk about the omega alpha supplements and how Dr. Trish uses them, in what situations she uses them in her practice. If you wouldn't mind sharing that with our group.
And so I certainly have all of these in my clinic, as well as the rest of the line, the organ specific stuff. The probiotic 8, every single animal in my practice needs to be on it. Even if I get that healthy puppy, I go, look, they're chewing on crap, they're licking on things, there's stuff going through their GI system that has no business doing. Let's just preventatively put them on a probiotic so we can condition them through that chewy stage. Let's just cover that basis. Once we get them past that and they're acting like a more mature dog and maybe they're not chewing on everything, then I look at, okay, we may be able to drop that. If we drop it down to 2 or 3 times a week, if everything's just as good, that dog may be fine during that period of time. If you drop it down to 2 or 3 times a week and something's not as shiny and glossy and wonderful, then your pet's gut's going to need that support on a daily basis. And so we customize it to each pet, but everybody is on this. Everybody in my family's on the human version. All of our horses at the clinic or at the stable are on the horse version. It's just, gut is so preventative. And so that's just a basic of everybody. If they've got diarrhea, we give them more of this, because by the time we're blowing it out the back end, we need to repopulate the gut faster. We need a higher level of the herbs that are in this to calm down inflammation of the gut. And we need a higher level of the psyllium and apopectin to kind of get the gut under control. So it's with diarrhea, to feed the stuff down them, get lots of it into them, and it will calm down the diarrhea. And I will use this 90% of the time before I'll ever pick up a metronidazole tablet to calm down the spasm and slow down the diarrhea. And 90% of the time it works. You'll get the one here and there that doesn't, but that's okay. The second one, the OptiPet, is one that we keep around primarily for those dogs that are eating dirt. The OptiPet is a high mineral content. And so if we've got a pet that's on a good food and they're digesting, they're in gut healthy, and they're just eating dirt, they're looking for minerals. There's a reason they're doing that, I guess, unless they're a puppy. But there's a reason they're doing that. And so I will put them on this for about 6 weeks. And what I'm looking for is, do I get a resolution of that? If I get a resolution of that in 6 weeks, I stop it and I see if it comes back. If it does not come back, we had a deficiency, and normal balanced food did not have enough to fix the deficiency. So we need to boost this up to fix the deficiency. If we stop it and it doesn't come back, problem solved. If we stop it and it does come back, then we have a situation that that pet uniquely has a higher need of certain minerals than average dog and average dog food. And so then we titrate down to what amount keeps them, and that pet's just going to have to stay on that. I don't have in the front of my brain what is the other one that's just the vitamin. It may be the Nutrify, but I can't remember it right now. There's another product that we have that is primarily more the vitamins. If I've got a pet that's eating plant matter, they're out there eating grass and eating weeds and eating this stuff. What do our plants have? There are salads. They have our vitamins. And so if I've got the one that's eating dirt, I need the minerals. If I've got one that's eating plants, I need the vitamins. If I've got one that needs both, okay, I'll use both. But it is a which one is which. And it's very specific. And dogs don't just graze like a cow do. They go out and they pick this blade of grass and sniff around in this blade. They are medicinally choosing what they're putting in their body. And there was a very tiny study done some number of years ago, and they looked at what pets ate when they ate plants. And the pets that ate plants and threw up, when they looked at the plant matter, they were actually eating plants that had irritating factors. They were trying to throw up. And when they looked at the plants that ate it and kept it down, they were eating the ones that had vitamins. They were out there eating their salad. And so I go, well, this one, we need to calm down the inflammation, more probiotics. And this one, maybe the healthy pet, on this one, we just need to adjust their nutrition accordingly. The healthy pet is a combination of herbs for that inflammatory bowel. And so some other immune things as well, but it's primarily got the marshmallow root and the various things for irritable bowel. And so if I've got that chronic irritable bowel pet and they'll tolerate this in their food, because we do have to take that into consideration, then okay, great. On a regular basis, they have irritable bowel. I'm not going to make that go away. I am going to control it. We don't heal irritable bowel in most cases. They either have it or they don't, and we manage it. And so this is a key part too. How can I manage that? The pet vitality is more for our geriatrics. So it's got a little bit of several of the things in. And yes, you do have to give a little bit more than you would if you had the individual, but it's a whole lot easier to sell them one bottle and say, here, give them a couple teaspoons of this a day, than here, take these 5 products home and give them a little bit of all of it. So it is more of a owner compliance convenience than other. The Sinew Pet I use for mainly my older working dogs. If I've got a young dog that's a 2-year-old agility or a working cattle dog or herding dog, yeah, they're adding more work to their joints, but they need a simple glucosamine sulfate and things of that nature, and maybe the anti-flam as a muscle anti-inflammatory, the anti-itis. And but if I've got that dog that now it's 10 years later, they may still be running or they may be retired from that athletic job, they now are going to have a little bit more arthritic and joint issues. And so that Sinew Pet is what I'll reach for to go, you know, we're just going to have to maintain this because they were a hardworking dog. And so how can we keep that joint health and all the surrounding things comfortable? So, you know, they each have their purpose. And then again, the things not pictured here, the liver tone, obviously, if we have liver problems, the kidney tone for that, the lung tone for that. So it really balances all together that we can work on specific organs if we know, or we can work on whole systems like the gut.
I like the fact that you like to introduce things one at a time or not combine a bunch of things together, because I do agree with that. It's hard to know what's working when you've got a combination of a bunch of different supplements. I've always thought that myself.
Right. And sometimes we do have the circumstance that if I've got, particularly I've got a dog or a cat that already is a very difficult eater, very picky eater, obviously some irritable bowel or gastroenteritis or pancreatitis or whatever, I will sometimes start with homeopathics and really simple nutrition and get things balanced out, and start with nutrients that are doing their job in the gut. So the probiotics that's bringing things to balance, digestive enzymes to digest the food, things of that nature, because all herbs are food. They have to be digest, processed, and absorbed to get somewhere to do whatever we need them to. If I've got a pet that's struggling to digest, that's not going to be my first option. I'm going to concentrate on the nutrients that do their benefit right there in the gut. And then once I get things stabilized, then I can start experimenting with adding some secondary things to support the body better. And there'll always be the individual that, come hell or high water, you're not going to get supplement X into that pet. And I tend to say it can be an excellent supplement, but it's not the best supplement for that pet. We're just not going to add the stress of the body to trying to force feed that into them every day. We're going to go a different way.
Mm-hmm. That's the wonderful thing about the different modalities that you have to offer, is that it may not be this, it could be homeopathics and I know we're going to talk about some really interesting stuff once we get to the food portion very shortly. But before we get there, it means a lot what you say with regards to the fact that you've chosen to keep Omega Alpha. And I know you don't keep a lot of different companies that manufacture supplements at the clinic. So the fact that you've chosen Omega Alpha makes us feel very special. But what do you as a practitioner like about the Omega Alpha Pet supplement line?
I mean, any supplement that I choose, I want specific information on the packaging that really tells me they've done the things they need to do. I need to be able to see that they've had clinical testing, that it's proven to do what they claim it does. Again, sadly, in the States, we can mow the lawn next door and shove it in a supplement and nobody will care or catch us. And so that ends up being a problem. There's a lot of crappy supplements down here. There's some good supplements too, but I go, if I'm going to drop $1 or $100 on a supplement, I want to make sure that it's been tested, that it has some clinical relevance, that it does what it's claimed to do. But I also want that each batch of it is tested, because when we're relying on plant matter, we have to recognize that we can grow it and it can be a few degrees temperature off at a certain part of the growing phase, and it can make or not make certain nutritional capacity of the plant that we're using it for as medicinal capacity, additional information, and it won't have it. It'll still look like the green fluffy plant and we can grind it up, but it may not have as much of the actual medicinal component to it. So the fact that those get batch tested in some degree to make sure, yes, the milk thistle was a hardy enough milk thistle for us to choose to put in our supplement to use, is just important to me. The other thing that just is a really great thing is the symbiotic combination of herbs that we use. While I'm trained in Chinese herbs, I don't really use it very much, because one of the hindrance I found was that they tasted bad, and that they were all individual, and you had to use too many and too much of each one and it was just cumbersome and sometimes costly. And so I like the fact that you guys have went, well, instead of just using milk thistle, here's some other herbs that help the liver in a different way and help the body process this herb. And so you package it all together into something that delivers to the animal or the person or the horse or whatever, a smaller amount of stuff that has a bigger bang for the buck as far as being able to be utilized.
Absolutely, because it's not really realistic to have to give copious amounts of supplements or a specific nutrient. This is nice that it is very much synergistic. I like that as well.
Yeah.
Excellent. All right. Now the power of food, which definitely cannot be understated here. How important is diet with regards to canine and feline health?
Yeah, and it's critical. Again, I had a client years ago. She came in with a whole box, like 2 foot by 2 foot, full of supplements, and just started the visit with, "Don't talk to me about my food. I'm on the best food for my dog, and I add all of this stuff." And I was like, "Wow, you have to add all of that stuff, and it's the best dog food that you can feed your dog? Really? Let's revisit this. You shouldn't have to add this much stuff to make." And then she kind of went, "Oh, yeah, you're right." And so we have to start with the basis. Again, our own health. If we're driving through a fast food restaurant getting crap, we have no questions that we're going to have health crises and health issues to deal with. And the thing I always tell people is the general run of the mill pet food everything in those bags or cans failed inspection to be at that fast food restaurant. I'm not even talking organic or natural. I just want something that could be in a Big Mac. Now, the poorest form of nutrition I can think of, can I just get the bar raised to there? Because we are using refuse-based ingredients for 100 years in making our pet foods. It wasn't so bad until the late 80s, because when you manually harvested, when you butchered a cow, it was estimated about 27% of the usable tissue was left on the bone. And so that went into a dumpster, and the Purina or whoever came and got it. And that's what they made their pet food out of. The late 80s, early 90s, mechanical processing came about. And that became so efficient that less than 3% of usable nutrition was left on the carcass. So through no fault of the pet food companies, they're coming to the same processing plant. They're picking up the same bag of bones or whatever they're processing and taking it off. But we made the human food industry so efficient that it left so little usable nutrition for the pet foods that's why we noticed in the early 90s, the blues and all of these other foods came about, because people were just wanting real food.
Mhm.
And again, it wasn't anything that horrible that the pet food companies did. It was how efficient the human food industry got with the developing foods for us. And so that became a big process. And so now we have to look at, my rule of thumb is, when you look at the food, I want the first 2 words to have a heartbeat, is all I say. I don't care what protein they use. I just want more meat in that food than anything else. I want no wheat, corn, or soy. I don't care about the grain free. There's nothing wrong with some oatmeal or rice. The wheat, corn, and soy are poorly digested. They're pro-inflammatory. They create extra burdens on the kidneys. So I don't want those. And then I don't want anything listed as a byproduct. Anything that's listed as a byproduct at least draws into question everything else that's on that list. So that's kind of my 3 rules of picking a food. We can narrow it down accordingly for other reasons, for other health issues, if I've got a pancreatitis or this, bit, and the other, but that's kind of the basis. And then we kind of have to get into, cats are obligate carnivores. In the real world, everything they ate was wrapped in mouse fur right before they ate it. So the amount of grain and carbohydrates that they would eat would be about the size of a mouse tummy, tiny, tiny. And so all the rest of it would be the animal flesh. And so we have to really, by the time you've got first, second, third, fourth ingredient as a grain, we're so over carbohydrating and creating obesity and pancreas problems in our cats, because they have no carbohydrate need whatsoever. Yes, with breeds of dogs, there's the whole talk of feed them like they're wild. No, I'm sorry, a Chihuahua is not going to eat like a wolf. That's never happening. We have genetically modified these dogs, and that has brought about some complications and some weaknesses in their system. And so we do have to cater to that, while there are other dogs that can eat like that. And so all the way from the commercial kibbles all the way up to home prepared, cooked or raw, and commercial raw and freeze dried raw. All of those have a purpose, and they all have a slot based on what we can get our pet to do, and pet to accept. Again, I want 75% or better of my cat's food to be their wet food. I don't mind if they put some dry down for them to nibble on, but I want the bulk of their increase input to be wet. But some cats have such irritable bowel, the wet's a stronger smell, and they won't touch wet food. And so at that point, I go, okay, we're going to pick the best dry food that they'll tolerate. And that's as far up that nutrition pathway journey as we can go. And so there are going to be roadblocks that we just get up that as far as we can go, all the way out to the home prepared raws. Our groceries that we get in the store do have an acceptable level of the bacteria, the salmonella and listeria and clostridium and all of these. And so we do have to recognize that while if the pet's perfectly healthy, it's probably going to do exactly what it does and stay out of the gut, and there'll be more bacteria in their feces. But if we have somebody that lives in the house that's immunocompromised, we need to realize maybe we don't need them walking around on the dirt where our dog poops, or cleaning out the litter box, or anything of that nature. It may be a great decision for the pet, but maybe not for a family member. The commercially made for pets raw foods, they actually have to go through quite a bit of criteria of getting tested to 0 amount of the 6 primary organisms that we're worried about. So, I jokingly tell people the frozen stuff that you're feeding your dog is actually to stricter control measures for all those organisms that we worry about than the groceries we're buying in the store, which is why you'll seldom, if ever, see a recall of a raw pet food for a salmonella or whatever, but heck, half a dozen times a year we're pulling every spinach leaf and this bit and the other because of it, because they're acceptable levels in our groceries.
And this is what I like, just to mention to the group, that Dr. Trish is definitely a rarity, because what other vet do you know that has the extensive knowledge in nutrition that you do, that you can offer to your clients as well, which is perfect when you're looking at all the other modalities that you use.
Yeah. And, and I tell people I work well with other vets, but nutrition is where I draw the line. When I get the vet that got 1 3-hour afternoon when they were in vet school by Science Diet, teaching them how well Science Diet is. Against, I'm sorry, I've got a bachelor's and master's and extensive training beyond that. I'm like, I'll arm wrestle them any day to go, no, you're wrong. And I've had circumstances where I called the University of Florida one year for a kidney bladder case on a dog. I'm sorry, on a cat. And I called him up and got the resident, and we're talking about this for me to do a consult. And I say, I've got the pH balance and all of that stuff. I don't really get into that. Yeah, I'm not feeding the food that you want, but I've got the pH balance. And he says, oh, we don't think that's a valid point anymore. We don't worry about balancing the pH anymore. That's not really a factor. And I said, really? You guys don't sell CD and SO, all these medicated foods that acidify the urine? And he said, oh yeah, well, of course we put that on. Of course our bladder and chronic cystitis, cats and dogs go on that. I was like, you do realize that that's just a crappy food with a urinary acidifier in it to modify the pH so that things don't crystallize and support bacterial growth. And he's like, oh, and I was like, respectfully, I can't use you for my consults anymore. I need somebody else. If I had to teach you that, I'm not accepting that you're an expert in anything to do with the kidney. You need to get me to somewhere else. And he actually went, completely understood. I've got you. Let me get you to somebody else.
Yeah, absolutely. What else can you say, right? Absolutely. No, that's good. And that's wonderful. Thank you for sharing all of that information. By the way, I am going to send everybody the link to Dr. Trish's website. She, for all those, the articles I mentioned earlier, and there's a lot of great information there. And she also does the consult. So if you ever want to reach out for that, I will send everybody the contact information. So don't worry. And we also have questions. I can see some coming up here. My last question for you, Dr. Trish, can you please share some of your success stories? I know you have mentioned a few, but anything that comes to mind?
And everything from, I'm now getting 2nd, 3rd generation pets where I'm having people actually bring me healthy pets after we've taken care of the pet that came to us with problem when we got them through their final years. But still the bread and butter is all of my allergy and skin dogs, all of my inflammatory bowel disease, pet cats and dogs, and all of my orthopedics. I mean, those are still the backbone of my practice, because those are things that classically in the conventional world we just can't fix. And we don't, and the meds we use have very bad side effects. And so the clients tend to get frustrated, and that's why they end up with me. And so, you can go on my website. I've got a video of a little dog named Blue, that 4-year-old little Shih Tzu, just for no reason that they knew, acutely was paralyzed in the back end. Went to UF and all this stuff. They weren't sure what it was, but really had no therapeutic options. They said, we can do a bunch of stuff, but we don't think we're going to help your dog. And we worked on it, and we actually had the opportunity. One of the staff members that worked with me was all good on videos. So she started videotaping the dog as it came in, and over about 2 months, we got that dog back up and walking, and it's still got a little funky gait to the back end, but we're 4 years out now, and the dog is up and going. I mean, it was only 4 years old. It was owned by 2 elder individuals that were not going to be able to manage a paralyzed dog. So this was literally a life and death situation for this little puppy dog. And Blue still comes here and gets his adjustments on a regular basis, and he's doing great. So, we can have all of those that just, we can restore things that they can't. I've had cancer dogs. We do lots of cancer dogs, and we treat them holistically. We treat them with nutrition, with enzymes, with detoxing the body, with trying to unburden and strengthen the body as best we can, with ozone, with everything else. And we can get tremendous success with those. And I mean, everything from, I had a little miniature pincher referred in, and it had a tumor blocking up its entire right lung lobe. And the dog was struggling to breathe. And we did some things, and that dog literally got good. It ran and played and everything. And it was probably 3 or 4 weeks. And she said that dog ran and played, and we were out playing stick, and it ran and got the stick, and it jumped in my arms, and it simply stopped.
Oh,
It was done.
wow.
And she said,
Yeah.
I can't thank you enough for giving me 3 or 4 wonderful, vital months, weeks, and then it was over quickly. And I go, sometimes what all we can do is just wring every bit of absolute health we can out of the pet. And when the fuel runs out, it can be a very quick transition in the end. So that was kind of where we
Yeah.
go with those. And yeah, so I mean, from skin problems to orthopedic problems, gastrointestinal problems like mad, you know, helping them digest their food, balancing out their gut. You know, I jokingly, you know, talk to people about, I've got, you know, in the vet world, we'll have these little anagrams we put on ADR, ain't doing right, for the deep south. And those are literally things we put on their records. It's crazy. And I have one that's SOS, and I tell people it means stupid owner syndrome. And I don't have any qualms with telling my owner, look, I'm doing everything I can. Here's what your pet's problem is. I need you to stop doing this. And because you're part of the problem. And they'll turn around. Sometimes you have to be that blunt, and they're like, oh crap, she really means this. Yeah, I really mean that. Because we have to. I have overcupitis, which means I can't get the owner to stop overfeeding the dog. They're tipping the cup too many times. And so I go, yeah, I'm going to have to sell you a more expensive food that's calorie restricted because you're not doing what I tell you to do. And you're going to have to spend $10 or whatever a bag more. And when you finally get that under control, we'll go back to feeding the basic food that we don't have to guard your excessiveness. And then you can do whatever you want for that extra money. So
Excellent.
sometimes we have to fight a little bit against the client.
Yes, for sure. And some people take a little bit longer to kind of come to terms with it too. And, you know, but ultimately they do see the results at the end. So you can't argue with that.
So I want to address Karen's question here. So Karen, the first question I would have to you is, how much does your pet defecate? Because we start off with, are we on a good food? And we get the supplements, the probiotics, the Nutrify, all of this stuff. But then we want to look at how well is that pet digesting their food. We can feed the best food on the planet. And if that pet is not making enough enzymes to absorb, break down, and absorb the nutrition, they're pooping it all out. And so before I start adding additional nutritional supplements that they may not be processing, basically in good quality over-the-counter kibble, it's going to be 65, 75, maybe even 85% digestible on some of them. So I go, fine, 75%. If a cup goes into that pet, a quarter of a cup, maybe a third of a cup of poop should come out. When we get into our home prepareds and our raws, they're more the 85, 95% digestible. And so at that point, if a cup goes in, a few tablespoons should be coming out. At this point, as long as you're on a good food, so yes, with the 2 and 3 small bowel movements, again, what's the total quantity? If she eats a cup, if you added all of her poops together, is it that less than a third of a cup or less? And so if that's the case, then yes, I would go ahead and add the Pet Vitality, or increase the Nutrify. Again, the Pet Vitality is more of a broad reaching. The Nutrify is more that vitamin supplement. So again, if she just needs more than average dog, then boost that up. Now, if you're doing a home prepared raw, you're going to want to use both the OptiPet and the Nutrify, because one's more of the vitamins, one's more of the minerals, and we need that for a well-balanced diet. We're going to need both of them. They each have a few of the others, but when we're really having to power it in because we're making a home prepared, if you've got one of the prepared things, then they're going to be good, and we're just going to bump up as needed. And so with your raw fruit and veggie, you want to make sure that you're feeding approximately 60 to 70% of everything that's animal. So all of your meats and egg and everything of that nature, and 30 to 40% is the balance of all your fruits and veggies and things of that nature. We don't want to overcarb them, even if we're saying, but wait, she's out looking for more veggies. I would bump up her probiotic a little bit, and see how that does. And then also realize that with raw, sometimes what we have to recognize, raw is more difficult to digest. And so we may not be able to extract that from it. If you're feeding a red meat, you may go down to a white meat. It's just an easier to digest food. If you're, whatever you're feeding, if you're still having, you may, what I call hot shock it a little bit. chop it up into little pieces, do a very quick 2 or 3 minute of a heat cook. It'll break down the nutrition, the protein a little bit, may make it a little bit easier to absorb, but you would have to give crazy amounts of these nutrients to overwhelm her system with the vitamins and minerals. So back to the original part of, will you overwhelm the system by adding the other supplement? Absolutely not. The Pet Vitality, absolutely not. Again, you'd have to give a huge amount of it to do that. Very good.
Excellent. Thank you. That's great information. Always wondering, especially when you've got vitamin and mineral overlap in the different supplements we make. Thank you.
Yeah. Now, the other thing I will tell people that are doing your meats that you're handling raw, if you're feeding them chunks, I personally assumed the butcher was a slob. And I tell people, cut your chunks into little 1-inch blocks, do a 30% organic apple cider vinegar and 70% water, and soak those meats for about 3 to 5 minutes. You can let it air dry or you can rinse it off. That doesn't matter. It does a reasonable job of limiting some of the surface bacteria. If we're using a ground meat, basically 1 to 2 tablespoons per pound of meat, and you're going to massage it in and mix it in and then kind of flatten it all out and let it air for a little bit and then divide it into your meals. Again, that organic apple cider vinegar, it's a nice kidney detox. It's good for the animals, but it can do a reasonable job of just lessening the bacteria. So I just always tell people, when we're getting our meats and making it ourselves, just run on that option of assume the butcher was a slob.
Excellent. Thank you. Any other questions or comments for Dr. Trish? Thank you, Karen, for your questions, and Dr. Trish for your answers.
And as you said, I've got lots of videos attached to my website. I've got lots of articles written about lots of common things. And in the articles, I do go through, here's the condition, here's what we think is going on with it, here's the conventional approach and treatment options, here's some of the alternative things that may be used instead of or blended in. So I do try to approach those articles from all aspects. It's not that conventional medicine's the worst. We want to blend them all.
It's excellent. And there is a lot of great information. I've gone through that website thoroughly. And I do remember that video that you mentioned about blue. I think it's right on the main page when you first go in, I think. Yes. Yeah. Excellent. Well, then I think that's it. And Dr. Trish, thank you. On behalf of Omega Alpha, I'd like to thank you for joining us this afternoon. Oh, we've got another.
Thank you for your time and wealth of knowledge. You are so welcome. And again, any of you guys, feel free to reach out. Joanne will share my email, my website, whatever. You can reach out if you've got additional questions or specific case-based questions. And excellent. For those of you that have clients that you're like, wow, this is above and beyond, I do consults as well. The limitation legally to that is, if I need to prescribe a medication, I have to have laid hands on the pet and established that client-patient relationship. For nutritional consultation of things that are over the counter, they don't have any restrictions on that. So it does, and sometimes I'll have, wow, I really need this test or this test, and if they haven't gotten it done, I go, well, go ask your vet to run that test. They'll happily take your money and run that test and then fax the results to me, and we can go from there. Very true.
Excellent. That's fantastic and excellent as always, Dr. Trish. Thank you again. And I guess I will see you again tonight at 7. Thank you. Right. Thanks everyone for joining us. Really great to have you join us. And thank you again, Dr. Trish.
All right. Bye-bye.
Bye, everyone.